Oh, it looks like Kimberly's joining here. I didn't know that.
She said she's running as a member of the public.
Oh, of course.
I have a question with
Is that?
this problem.
I, after this, the West Side 45, a number of men they asked. So I
Ah, well, Z and I went to Sweet 16 in Golden One. Friday was saying I was at UCLA. And probably the best game of that weekend, which was the Duke game.
Oh, you saw that?
Yeah. Never done better. I ate too much bad food. The pizza was okay. The tri-tip salad wasn't.
My favorite.
That's for something the Golden One.
Oh, really?
Yeah.
Okay.
Yeah, good seats. It was kind of like the eighth row. Yeah, section 116, just kind of like a.
Did you get part of the, did you get to go to the party meeting? Like the wristband?
No, I think that's more in the middle.
I didn't even know that existed.
Oh, it's very, breaking out on the assembly and the Senate.
Interesting.
Used to go a lot of Kings games.
Have we started?
Oh, it's 1, 2, 3, 4, 5, 6, 7, one more.
We can start without, we just won't do any business.
Or we don't, I think the minutes for the.
Yeah, we'll hold off until, I mean, Meg's gonna be here any moment now. And we can do that. All right, so it's 6:08 PM. We're gonna open up the meeting. And this is Jonathan Raven here, past chair, filling in for Meg, who's gonna be here momentarily, our chair. So let's start off with any public comment. Any public comment?
This question, please. My name is Lou. I'm the new executive director of Nottaway County. And myself and our board is really thrilled that you guys put out the 2025 annual report. It looks really good at first. And yeah, I wanted to remind everybody that on April 15th, we have a live event. I know some of you bought tickets. It's a great place to network with your colleagues, and we've got a good speaker for that day. Look forward to seeing you all then.
Hi, everyone. I'm Donna Neville. I'm Vice President of the NAMI Board. And I just want to echo what Lou said about the report. I think maybe it was a year or so ago, I stood before you and really urged you to get back on track with doing the annual reports because you have so much power as a board, and I'm so appreciative of the work that you do. So this report where you are reporting to cornerstones, so glad to see. I'm sure to say it. No, I'm repeating what Lou said. We'll have to step out for another meeting, so I apologize. Leaving early, but we're gonna thank you.
Let me just comment on what you said.
Yeah.
And I get to do this since I'm acting chair.
Yeah.
So first off, you guys seems like you made a great hire in Lou. I've had a chance to get to know, and Lou came to the mental health board graduation this week. It was great having her there and spoke. So that's great. I want to say to you that NAMI has power too, and YOLO NAMI. And I'm just going to say out loud, prior to you coming on board, you know, YOLO NAMI played more of a role in terms of advocating. And then I think what happened is they went a little too far. And in my opinion, and some others, there was kind of an overcorrection. And now, in my humble opinion, YOLO NAMI is kind of very much reticent to advocate, not wanting to ruffle feathers, which I totally understand. But I hope that with Lou and the board, of course, with the board under the board's direction, YOLO NAMI will advocate a little more, and we're going to advocate for YOLO NAMI, and we're going to advocate for everything mental health also. I just wanted to share that with you.
Thank you. And I know we're not supposed to engage in a colloquy during public comment, but I'm all about advocacy and not at all to come together. So it's a resource. Unfortunately, we're in this.
Yes, you are.
Takes away from my advocacy.
Thank you. Thank you both for all you do. Anyone virtual who would like to make a public comment? And there will be opportunities later. And if something comes up and you're still here, you want to comment later, you can. Anything else? Any other public comments? All right, seeing none. Let's go to, we still don't have a quorum, is that correct?
Mhm.
Okay, we'll have one momentarily. So we're gonna skip items 2, 3, and 4. And move to any member announcements.
Sure. I participate in the Opioid Coalition, and last year the coalition staffed a table at the county fair. But we're not going to do that this year. We're going to try and do a number of different events. Hopefully participating in the National Night Out with West Sac and Woodland. Before Donna leaves, we are trying to get a resolution again from the Board of Supervisors. And this year, hopefully, we're going to have city acknowledge the International Overdose Awareness Day, August 31st with a resolution. So, expanding that, and that'd be memorial, looking at trying to do one of those positive communicare on the 31st of August. So it's kind of like a change of pace for what we did last year to this year. The bandwidth to do county fair, which requires staffing for 4 days in a row. Can't do that every year. But the idea is to engage and hand out Narcan and fentanyl test strips, along with other educational materials. That's kind of what's going on with that.
All right, thank you, Chris. Anyone else? Any board members that are participating as local behavioral health board members online that would like to make a announcement? Okay, moving on to item 6. Do we have any correspondence?
No.
Item 7, Board of Supervisors.
We are gonna have a board of supervisor join us. He's gonna be a little bit late because he has another meeting, so
Okay.
later on,
We'll come back
he
to
will
that.
be here.
All right. She had a schedule, so let's see, let me think for a second. I'm just wondering if we should wait a couple minutes, since we are ahead of schedule. Maybe get here, here, you guys. Let's, hopefully this will,
Walmart committee reports.
well, I'm trying to think, like, if we are ahead of schedule, sometimes it seems like we are. How long is your?
Not very good. It depends on how many questions. Yeah.
Right,
It's like all about audience.
all about audience participation. Okay. Well, then, let's just, I think what I'd like to do, because I feel like we're a little bit ahead of schedule in deference to our chair, Meg, who's on her way. Let's take like a 5-minute break. Is that okay with everyone? We can talk amongst ourselves. Got a basketball game on here?
Yep, this will be my third game, but man, after the first game, it took me about 5 minutes to go all in one.
Did you, have you ever played in a while? Or?
Yeah,
And you gave up on socks, right?
but I mean, I get to my basketball shoes, but just gonna get out there. And it was fun, but
What's the league?
so it's the West Side recreational basketball, but like really it's the guys that play in college that still love the game.
Seriously?
You know what I mean? Yeah, and play, so I'm definitely like,
What made you do that?
I miss it. Like, I love. I wrestled in high school, like, I like roughing the ball. So it's just an opportunity to just,
Wow.
you know,
Do you know anyone that plays?
I do actually. Like one guy's actually the Davis, like, I know he can punch basketball, it's in Zach. Anyway,
Power forward?
he's like 6'8", and he's got
Yeah.
50 pounds on him. Yeah, so like, definitely like, I don't feel bad, you know.
20? So I'll get moving on it because I'll keep you settle in. We now have quorum, so there are a few things we couldn't do.
Okay.
So we're gonna go to item 2. I'll cover until you catch a breath. Approval of the agenda. So moved by Chris.
Second.
Hey, and Melanie and, all in favor? Opposed? Abstentions? Okay, it passes. Excuse me. Approval of the minutes.
So moved.
Chris moves.
I'll second.
Okay, Jennifer seconds.
Thank you.
And, all in favor, say aye.
Aye.
Opposed? Abstentions? Passes. All right, we're up to the chair report. All you take it from here.
Do you have anything you want to say?
Huh?
Do you have anything you want to report out on? Just wanted to, we were scheduled, May 5th to present, our annual report. We can present during then, so we're gonna, I think it's June 5th. So Kimberly at this point is gonna be presenting, and so let everybody know if you're interested in being there. I think it's at the board of supervisors meeting. First one in June. First one in June.
And that's, everyone can watch that,
Right.
on virtually too.
Yes, but if anybody's interested in.
Great.
Either presenting with Kimberly or being there is somebody.
Do you need assistance with getting that on calendar for the board?
I'm already taking care of assistance.
All right, okay, all right, perfect.
Also, I think there was a request to create an ad hoc committee. I think our next, after this next site visit, is the jail. If I'm understanding correctly, so to create an ad hoc committee. For to figure, I mean, that's a big contract, that's a big contract document to review, and also there's a lot in the jail, a lot of services that are, in that space, so determining what exactly the site visit would entail. So if we could form an ad hoc committee to determine what that would be.
Do you think that it would be of any assistance to have like a pre-meeting before going on these site visits? Like, so for example, we have, there's a little bit of complexity to the way that the services are provided in the jail. It might be helpful to meet with the manager who oversees those programs.
You're appointed chair for that?
Well, I was gonna report, yeah, so Chris will chair, will lead
Okay,
that group,
All right,
and I think that's a great idea, and I think probably a good idea for all the site visits, but especially the jail, it's a little bit more complex than anything we've
Right.
done so far.
okay,
Yeah, my idea for that was to try and narrow it. It was more of the mental health services, as opposed to addiction services, the MAP program or SH, just to try and narrow it. I did talk to our new executive director of NAMI, try and have some sort of outreach component, so family members of inmates, so I've seen a lot of complaints from family members about treatment in the jail, to get some feedback from them before going. And kind of taking our time to plan this. So I won't be here sometime midsummer.
and just, for whatever it's worth, I know that also Public Defender was doing some sort of a survey, over the last.
We're also gonna engage, I think, Emily Coakley at the Public Defender's office,
Okay.
the head social worker, but
Okay.
I don't think we need to, that could be, actually, because county employee, we can get feedback from them
Sure.
before we go in, so we can try and
Got it.
make sure the site visit covers all the different concerns.
Okay.
And look at the contract, try and narrow it to a part of it, because there's a lot there.
Mhm, okay.
So that's kind of my idea for that. I don't know who's interested in being on that committee. But that's something I'll
Yeah.
start working on.
Yeah, and if you're looking at doing one site visit a quarter, we have this site visit, so this wouldn't be until third quarter, probably. We're looking at maybe, yeah, third quarter, so we have some time, but I appreciate you guys getting.
I just
It's a
think
lot
it's
of
gonna,
work.
it's gonna
Yeah.
take time to coordinate the outreach component. Then making sure, the part of the contract we're gonna look at, we narrow it so that we have a manageable. Like the applicants.
Their suggestion is that I think Pine Tree Gardens came up as a potential for the next site visit. I don't know if we need to have this. We would need to have a separate ad hoc for the Pine Gardens. What I'm looking for feedback on is would we want to start a separate ad hoc for that? So just in case, because the jail is so complex that if you had to do Pine Gardens before the jail, you would have that to get ready.
Okay.
It's okay to say no. That was a thought that someone wanted to also create the ad hoc for Pine Gardens as well. And if
That's a
there's,
great idea.
if there's somebody who's interested in running that, being chair of that ad hoc.
Is this the time that you want
For Pine Gardens, yeah.
to sign up? Is this a good time to say, to determine that?
Well, I think we're trying to get a chair,
The chair.
person take the lead.
Well, I'm already the chair on this one. Do you want me to be the chair again? Since we're trying to kind of get the process down. We haven't even done our first visit yet,
Right.
but we're gonna get there. I mean, we're almost there.
I think we're scheduled for later this month.
Yeah.
If you wouldn't mind, and then, once you get a group together, if you guys
Okay.
want to change it.
Yeah. Is anyone okay with that? I'll be the chair on those. Did I have people that will join me?
I'm sure they're getting we're missing the members tonight, but I do know there was some members that are missing that has some day stuff. People that will be wanting to join them. Okay, great, thanks.
So we're on 7, and I think we're still waiting for someone to come, from the board of supervisors. So.
Lucas is gonna be joining us later.
Okay. So, we'll be where the presentation's in.
I'm Carrie Colbert, the Behavioral First Healthy Manager at Yolo County Behavioral Branch, and this is my partner.
I'm Bex Wentland, the Program Director for Enhanced Care Management and Community Support with Turning Point Community Program.
And today we're gonna present to you on a new CalAIM measure that came out, transitional winds. And I will hand it over to Bex because it's her PowerPoint.
All right, well, it's my old PowerPoint, and I'm just gonna let you know that Carrie sent the wrong one, so there might be some typos. No judgment.
That's a new one,
Just
so.
did an app. We're shown.
Yes, we are on.
The next slide is fine.
Well, let's point out like where the changes are so that they know it's not far-fetched. Okay, it's far for them from the new one, right?
Yeah, there's just typos.
Oh, why?
They're just embarrassing moments.
I'm sorry, I didn't know that. I would have. Really.
So transitional rent is a new housing stabilization benefit under CalAIM. It is the 15th community support. And it is for Medi-Cal members who are experiencing or at risk of homelessness and have significant clinical needs. We will discuss those clinical needs in a minute. So the benefit essentially provides up to 6 months of rent for those who qualify. So it is, in addition to paying that rent, it also comes with support services to help sustain that housing. Yeah, sorry. So it covers the full cost of the rent for permanent settings, but like apartments, shared housing, ADUs, or interim settings in hotels or single room occupancy unit. As well as some ancillary costs, but those have to be bundled into the rent payment. So if utilities are part of the rent, then we can cover the utilities. If storage is part, then we can cover that. But it has to be bundled into the rent, and it does not cover food or meals. With some, I guess it doesn't really cover the room and doesn't really cover the board in BHBH, but BHBH covers the board.
Well, so,
Is food provided?
at one of the facilities.
Okay, so it really depends on where it's at.
So let's bring it back a little bit.
Yeah.
So there's another program that's called the Behavioral Health Bridge Housing Program, and we have opened up 2 facilities. One is in Woodland at the old emergency shelter. The population that they serve is the same one that aligns with transitional rents. And then there's another one in the city of West Sacramento. The 2 programs provide housing, but they are a little different, as the one in Woodland provides meals because they have a kitchen and all of that. The one in West Sacramento are individual units with 2 to 3 roommates in a unit. So that's an old motel conversion. And they do not provide food for those individuals. We do connect them to CalFresh to make sure that they have access to food. And we do have access to food banks where they can get food.
So in that one setting, it might cover food. So the services that come with transitional rent are that our program will help identify an appropriate setting or unit for that member. We will help inspect the units to make sure that they are habitable. We will support with lease agreements. We're not attorneys, but we will do our best to make sure that the lease is compliant and legal. We will issue the monthly rent payments for 6 months and then coordinate with all of their other supportive service providers to make sure that it's a full wraparound approach. These are the settings that are allowable. Basically, any kind of setting you can think of is allowable. I love that they gave us a list. But if we can make a lease for it, they can live there. And we have MOUs for our interim setting. All right, so this transitional rent is part of CalAIM, and it is really intended to align with enhanced care management and community supports. So most of our transitional rent members are going to have complex health needs or social service needs. So we would provide that like boots on the ground support, really make sure that people are linked to all of the services that they need to live their most successful life. With housing, with our community supports trio, that is housing transition and navigation services. So we're helping people find that housing. We can then pay up to $5,000 for a one-time assistance for a security deposit, and that can cover some household items. And then our tenancy sustaining services, which will hopefully, for our folks that we get permanently housed, this will be what helps them keep that housing, and we'll work on housing support plans to make sure that we can support them in sustaining that housing long term. These are our clinical risk factors. So everyone who, to be eligible, you have to meet the clinical risk factors for access criteria for specialty mental health services, drug medical, essentially. So, and then you have to be homeless as defined by the U.S. Department of Housing. But we have some updated information that now we're going to move with DHCSs. So that has been updated. But really, essentially, we all know the description is the same. If you don't have a house, if you don't have shelter, you are homeless. If you're at risk of losing that, you are still eligible. So, and then they have to be part of a transitioning population. So transitioning out of an institute or congregate residential setting, transitioning out of jail or prison, transitioning out of another interim setting. So we can move people out of motels into, or other interim settings, tiny homes into permanent housing, transitioning out of recuperative care or short-term post-hospitalization housing, transitioning out of foster care, unsheltered homelessness, or they are eligible for full service partnership services. Would you like to discuss the enrollment process?
Sure. So the enrollment process, member is referred to Bex's team, so Turning Point. There's no wrong door referral. Process means that the referrals can come from anywhere. So after the referral, Turning Point meets with the member to complete the intake paperwork and assessment to determine eligibility for the criteria that we previously stated. At that time, there will be an intake assessment, will be submitted to Yolo County for final determination, which would be the team. And then county may provide additional clinical assessments, so we will validate what Bex has vetted to make sure that the clients are eligible. Then we will hold a MDT meeting, our multidisciplinary team. We will bring in all the providers and supports for that client. So housing provider, behavioral health provider, if we need an ECM provider, if the ECM provider is different, because that could be a possibility. They will be at the table if they are part of probation. We will bring those people to the table. We want all of the supports at the table to help wrap around the client. At that time, it will, the MDT will approve the transitional rent service. If the member meets the criteria, also at that meeting, it will be determined, the length. Because not everybody's going to need 6 months. So in that MDT, we will be looking at the housing support plan, determining what the client's individual needs are. Some people may be just needing a couple months rent assistance and then they will be self-sufficient. Others may need the total 6 months. And then we're going to want to know after the end of that 6 months, what's the plan? How are they going to sustain this? And so that meeting will be critical in determining the length of the payment to the client. They are eligible for 6 months, and if they need it, they will get it. But we do want to, we're trying to bring all the services in so that we can support the clients to be self-sufficient if it's possible to meet their needs and if it's something that they are desiring.
And part of the intake packet or bundle, that we call it a bundle, part of our intake process is to work with the member to develop a housing stability plan. So in that will be, what is their plan for after 6 months, right? This is a once in a lifetime deal, right? So how are we going to help support after that 6 months? And that's where our partnership in that MDT is going to be really important. Bringing all of those resources to one table. It may be that they're going to qualify for support from the county, but hopefully we're able to help them sustain it on. And that could be with benefit, acquiring benefits or employment, whatever works best for them.
Is the domestic violence shelter for the transitioning population?
Or under criteria, transitioning from post-hospitalization, is that community psychiatric or would that also be acute care hospital? Should be any hospitalization. Okay, and then it says eligible for FSP. So if you're not enrolled in FSP, but you're eligible, you still qualify.
Correct.
Yes, okay. Thank you.
How many people coming out of our jail go into this program?
The program has,
Or are you anticipating that?
I don't have the answer. I'm sorry.
We're currently receiving about 3 referrals from the jails a week. So my hope would be that a lot of those folk would qualify for this and that we could work in pre-release with their case managers, their care coordinators on the inside to help transition them into some sort of supported housing.
And for the BHBH program, we have gotten quite a bit of referrals from the jails. And so that's already a population that we're working with.
There's been collaboration with probation, so I'm assuming they're gonna be supervised.
We are in communication with Emily quite a bit.
Emily's not probation.
Oh, sorry. Well, the public defenders, that's our people.
Yeah.
That's who we work
Well,
with mostly.
for BHBH, I have standing meetings with the 2 providers and we bring in their probation officers, like on the referral form. We want to know who is the probation officer assigned so that we can be in communication.
And the referrals that we receive from the jail generally.
And just a disclaimer, this is the first time this program is rolling out, so we expect feedback when you guys have it. We're willing to, if you like, Chris, I know you got this down, so if you have any thoughts that maybe we're missing, reach out to me.
So the part here that's relevant with the Behavioral Health Services Act is that the BHSA requires us, or requires clients to exhaust these services prior to being able to, for the county to utilize housing intervention dollars. As you know, well, 30% of our allocation is being set aside for housing interventions. And there's a few different ways that we can utilize the funds. We can do rental subsidies, we do operating subsidies for like specific kinds of adult residential facilities that are non-treatment oriented. Of course, we could do like capital development project or whatever. These essentially would be individuals who would be kind of coming through and potentially going into like a rental subsidy program. And so part of the work here is to establish a, kind of a coordinated entry into these transitional services, and then also like kind of coordinating to determine which of these individuals, after they've exhausted transitional rent, may be coming over and being captured or being supported by housing intervention dollars, right? So, as Carrie's saying, this is a new program, right? But it's also going to be aligning with another new program with the rental subsidy program from the housing intervention funding. But it's also, kind of like one plane landing, one's taking off, right? With the BHH program, which is about to sunset its call, right? So it's a continuation of some existing work the county's already doing under Carrie's leadership and in coordination with the managed care plans through their contractor procurement fund.
How many slides are they talking about?
There's no number.
Thank
Zero.
I mean, I think we're,
The BHSA plan was posted today. The numbers are in there. I don't know. No, for in housing interventions, we are projecting to serve 180 clients. So that's our projection for the housing interventions. So, but I think for transitional rents, that's it's an endless funding stream through Turning Point. Just kidding. They're working with the managed care plans and they get a reimbursement for that. So it's not like there's a cap to how many can be served. It's just if they're eligible.
Well, and I was just thinking, you're talking about the different locations, you have, Woodland, and then you have West Sac, like how many units?
Oh, 55.
So there's, so 55 people total to go to.
Well,
West Sac.
that's just for VHBH housing, like there is the infinite resources, right? Well, not really, but there's a variety of housing opportunities, right? So I have someone right now who was just referred that had 6 months disability, but they started their job back up and they just need like a couple months to get back on their feet and get that support. So they won't be even utilizing the BHSA dollars, right? It's it's gonna be straight Medi-Cal dollars for that person. So I think it's really gonna depend on how, who is referred to us and who we're serving.
So it's Medi-Cal, so veterans wouldn't be eligible for this if they're getting service.
They would. But if we were to receive a referral for a veteran, we would make the appropriate referrals to get them.
And there's also a type of Medi-Cal, I'm gonna slaughter the acronym, it's like straight Medi-Cal, but it's DSNP. They are not eligible for the CalAIM services either. So that population has to go back to like the federal government through their Medi-Cal and get the kind of services that are being through. So that those are two populations, but yeah.
Anyone who has a managed care plan and is not part of the DSNP, we are.
And just to reflect on the CalAIM portion of the program, there are multiple providers in Yolo County through the Homeless Continuum of Care that have signed up to be enhanced care management providers and community support providers. So these individuals all have access to refer to transitional rent. And the kind of it's a community effort, right? Because we know that there's a lot of people that need help with services. And so when we're talking enhanced care management, we're really trying to capture the entire community and utilizing and braiding in the homeless continuum of care and all those nonprofits to also support this population. So it's really a transformation, I think, that everybody's been waiting for.
Yeah. Like that. So would there be any oversight? Because we know once, a lot of times people get out, they get out of jail and they get out, they struggle sometimes along the way. And sometimes substance use comes into play or whatever. In some of these environments, we've heard it here in the board meetings and we've heard it out in the community. So would there be somebody overseeing some of these particular sites?
There will be. So,
Okay.
you want me to-
Go ahead.
So, this service is really intended to partner with those enhanced care management and community support, housing sustaining and housing navigation services. So with that comes, I wouldn't call it oversight, but a lot of support,
Yeah.
right? So if, somebody has substance use disorder needs, we're gonna make sure that they're getting the treatment. They need, this is a housing first model, so we're gonna house people no matter what, and hopefully be able to put those resources into that, but we may or may not be the community supports or ECM provider. We will partner with those providers. Part of the transitional rent will be ensuring that they are linked to the services that they need. So that is part of our contract under transitional rent.
And from the continuum of care portion, because I oversee the homeless outreach team as well and am part of the HPAC board. The county is going to have a community supports provider meeting and really bring everybody that supports, because there are some community supports providers that are out of county. We want them to be using our homeless management system so that we're able to track, because part of accessing the HSA funding is making sure that they've exhausted these other supports. And so we really need to create data and monitor that. So we will be bringing in those providers to a meeting to talk about like expectations and what our needs are as a county to make sure that these clients are being supported and not falling through.
That's music to my ears.
There will be bumps, but we're ready.
Those planes Tony's talking about, we're building them
Yeah.
as we're landing them and taking off and. So.
Any other questions?
We do have someone's hand up online. I don't know if you're accepting online questions. Lydia?
Yes, hi. May I ask my question now?
Yes, ma'am.
Hi, my name is Lydia, and I'm actually a student here at UC Davis. And I work at a student-run clinic in Knights Landing, and I'm currently supporting a client, actually two clients, their husband and wife, and they're unhoused. And we have been looking into transitional rent for a month now, actually, because my supervisor works in like the housing authority in Solano. And so she has connections and she's been going to these trainings offered by Homebase. And a lot of other counties have already been laying the foundation and the workflow for transitional rent. Like, for example, Miss Wendy Wheeler, I'm not sure if you guys know her, in Sonoma County, I think Sonoma County. She already has a really great workflow for transitional rent. And for my client, we've been trying to find out how to get him into transitional rent, and it's been a really, really hard journey because as far as I know, I have not seen any solid workflow from Yolo County. And so we've already referred them to Partnership Health Plan, that's their Medi-Cal Managed Plan, to their ECM, and now we're waiting on their community support referral as well. And nobody seems to know what transitional rent is. And I've also reached out to Fourth and Hope, the shelter in Woodland, and they too don't know what to do with it. Yeah.
We do have a referral form. We do have a process flow. We are not presenting that today because we were just focusing on educating people on what transitional rents are. Bex and I will be going out. We've already done a few presentations with different, like with the homeless continuum of care of providers, and we will be doing a presentation at the Executive Commission to address homelessness. And we've actually presented to Communicare. So we've been out doing a roadshow to present transitional rents and what that looks like. We can go ahead make sure if you put your email in the chat, we can get you the referral form. We have told people that the turnaround time, because it's just starting, is probably 60 days. Because Turning Point actually just got their contract with partnership.
Like a week ago.
Yeah, so we couldn't, it was kind of on pause. So although we have the flow written out, we haven't officially moved into that space yet because we are waiting for them to get their contract with partnership, and then we have to have MOUs developed. They're in the process of being developed. Once those are developed and executed, we will be moving full force. We already have a list of individuals that have already been, or they're on like the wait list for us to get moving.
Yeah, we've got full intakes ready to go.
Yeah, and so if you put your email in the chat, we can make sure that you get the referral.
Yeah, absolutely. I mean, my client has already completed the VSPADAT, and they already got their score for that as well. So I'm not sure if that's the same intake form, but either way, it would be great to get my client on that same waiting list because they've already identified a unit, and it would be great to get things rolling for them.
Lydia,
Same referral in here.
yes.
Mhm.
Lydia, I will, if they've already identified a place, are they looking for a deposit or just the 6 months support to get into that?
First month's rent, yes, but also to sustain themselves after 6 months because they're currently the only form of income they have is SDI, and that only lasts, I think, 5 more months for them. And so, yeah.
Okay. Yeah, please put your email and phone number in the chat, and I can reach out to you. Bex and I can reach out to you.
Great. Thank you so much.
So recap on that. So basically you're getting up and running and you would expect within 60 days, then people should be aware, folks who usually utilize these types of benefits for folks that they would be, everybody would be in the know. It's kind of in the pipeline that.
And if you run into somebody that is not aware, please give them our information, because if we need to go present somewhere else, maybe we should go present too.
Can we?
Yeah, I was just gonna say, like, yeah, maybe would be great.
And anywhere else you can think of.
I mean, I think this is always a concern of this, well, our question is, how do we get this information out to the public, right? How do we let people know there's so many different types of services that the county and the state offer and also.
Well, my team will be updating the Yolo County websites, with more housing information with transitional rents, and then as the HSA rolls out in July. So we will be updating that to make sure that there's more information for people, but we are always willing to go out and present to whoever, any suggestions.
I'm wondering, they may already know, but do you know if the school district, Lincoln Evento homeless liaisons, this information?
I will reach out. I know, I oversee another grant, which is the Community Services Block Grant. And so we have reached out to the school districts and that also provides rental subsidies and deposits. And actually this year we're providing youth services too. So if you have a family that needs tutoring, but they can't afford it, we can offset that and pay for that. So we have other funding streams that we utilize. And so we've been in contact with the school districts for that. But I think this would be also.
Okay, yeah, I know they do a lot of, there's a lot of stress on families.
Yes.
They do a lot of.
Any other suggestions?
Going to the job center. Because quite often, I'm from Sacramento, so I'm not Yolo, but I'm just saying that quite often we get customers coming in who are homeless, who are jobless. So we help them with the employment part. And we're always scrounging around who to refer them to and connect them with. So I think reaching out to the job center would be a great
We
benefit.
have a great relationship with Yolo.
Awesome.
It's been a great program.
And then also, since I do oversee the homeless outreach team, we have been out to encampments and sharing flyers with individuals and educating them on enhanced care management and also on community supports and what does that mean to them and how do we connect them and get them signed up for those. So one of our goals is to make sure that everyone is signed up and that they are aware of that. Even if you're in an encampment, like that's the whole purpose. You want to make sure that they know that they have services that they're eligible.
Well, my number is on that referral form. If you have any questions or anybody needs to send over a referral. Beautiful.
Christina has my information.
I sent the referral to Lydia and included you on it.
Okay, perfect, thank you. Thank you, guys.
Thank you.
Next, we're gonna open up for public comment. Figure line has anything. This is Tony, the behavioral health director report out. Just remind everybody, you guys let us know which letters you want to pull off, and then we can ask Tony questions.
I forgot to include it in the packet you have in front of you. Sorry. But I have the report for Tony and it was sent to you in advance. Yes.
Letters are.
I'm happy to pull it up on the screen if you would like me to. You bet.
Yeah.
It's so hot in here. I was probably opening the outside door trying to make circulates in there, you know. And I feel like I feel like I'm about to pass out.
I'd like to know more about G.
Okay,
They're taking letters.
I don't have my normal thought process here, but that's okay. Okay, the RFPs. That's the only one?
G is the children's.
G. G
Yeah,
is G.
Yeah. E and G.
Adult full service partnership.
Okay,
I'm gonna leave this up there.
that's fine. And that one's G.
Are you looking for, any board members for any of the RFPs?
Yeah, we have every intention of including board members when we're at that point. So part of the RFP update isn't really much from last time. We were, do you see there's like a little footnote there about AB 339 implementation? And when we wrote when I put the report out last month, we were still waiting for some guidance from our county council and our human resources department. Now we have it, so we're starting to move forward with that. So when we get there, we'll definitely include it.
We can do that next meeting now.
You mean with selecting individuals?
Yes.
I'll defer to you. We may.
So what you're saying, you're not gonna need it until. after next meeting?
I don't think we're gonna be ready to go before the next meeting, but it wouldn't hurt to identify someone now, just in case.
I'd
My
be
perspective.
interested in the individual placement support.
Okay.
If that. Unless someone else is. I guess I'm calling E. I just wasn't sure we need to call it or discuss it or not. If this was just on the horizon.
I mean, my intention was like when we were kind of getting closer to that, to like.
That's
reach
okay
out-
with the chair.
Just to reach out to reach out to the chair and to talk about how to do it. I don't know, if we feel like we need to formally assign people from here. I think last time we did it informally over email, but.
Yeah, I think because it depends on everybody's schedule and when they need it. So the process has been, Tony lets us know, we send out an email and then people sign up. Open to other suggestions if we want.
If it's okay with you, I think since it's coming up in this manner, what I can do is tomorrow, just reach out to our contracts manager and ask for an update about where we are in tentative timelines and then just sort of.
Yeah, that'd be great. And then
Okay.
people know.
Yeah.
If you also, we could certainly have members let you know who's interested.
Yeah.
As well, but I
Yeah.
think with challenges in classes, all the time.
Yeah.
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 Well, I was on the RFP process for the after hours mobile crisis first time. And I had to go out a second time, so then I was notified, which I didn't realize I was gonna do it again, which was no problem. I would assume that since that was gonna come up again, that I would have been notified, so I guess we need to distinguish and let them know that we're gonna create a whole new team again. They contact me again and say, hey, they will.
I think so. That's how they've done it to me.
I think that it would make sense for us to reach back out to you since you're, involved both of the times before, but, you know, again, I think we would just depend on your availability.
That is on one I'm on anyway. I get notified.
Okay. I'm like, darn it, why don't we do this? No problem, no, I have no problem with that.
Definitely get a 319-page contract for you.
I know, right? It's all in there.
Well, I think that is the part that when you sign up for these things sometimes, yeah, I mean, you know, right? You know, right? It's a pretty big commitment, right? You know, many times when we receive these proposals, they're pretty extensive, and then the scoring process is kind of tedious, and then there's, you know, a lot of meetings with the other scorers to kind of coordinate, like picking the vendor, so.
Yeah. I mean,
It helps if you're interested in the topic.
With, I don't want to go too far off topic, but with mobile crisis, since, you know, we're bringing it up, one of the pieces that's kind of hanging around there with the governor's budget is whether or not they're going to make mobile crisis a requirement. I believe we talked about this last time, right? So I don't want to belabor the point, but essentially we'll have to be making some decisions if the governor's budget does not include funding for mobile crisis, we're going to have to make a decision about whether or not we're going to be able to financially sustain the benefit after hours. At this point in time, it's definitely questionable. I'll just put it out there. And so, you know, a big part about how we move forward with this RFP is going to be influenced by that decision as well.
The Health Council, I believe, is writing letters to our elected representatives about some health issues. Is this something that this body could do? We probably need to have board approval since we report to the board. But that body was encouraged by the board member present to explore that. To lobby our state assembly and Senate representative on this mobile crisis issue, about the importance of including it in the state budget.
I can't speak to what this board should do, but what I can tell you is that the Behavioral Health Directors Association did actively lobby legislators last month, and there was a couple of different issues that they were lobbying on. This was top one, right? Was to request that this benefit remain in the budget.
Yeah, I mean, we can certainly as prayers and comes as well. I mean, I think also all of us as individuals can certainly means others as well. But yeah, I think that's a good idea.
It might be something that, as the board,
We say yes.
we think this is important,
Yes.
and we probably all need to have a vote to say that it's important.
For sure.
NAMI California has a new like public policy sort of team, and we could ask NAMI California to write letters too.
Global crisis is really important.
They might have board resolution.
We should probably wait for our supervisor.
So we have perks for the lobby, but then for NAMI, we have a motion to. Anyone to NAMI.
Do that too.
As a
I think it's important. We work and report to the board. So if we go outside the board to like an assembly person or state senator, that's outside of the mandate. So we need to have a board supply approval from the board member to do that.
Correct, but I'm wondering, do we need a resolution? I don't know that we need to get on the minute, but we need board of supervisor approval. So I'm wondering, do we want to have a motion that we would create a request to NAMI to maybe see if there's resolution language that they could share and support this.
I'll make that motion. What'd she say? It looked really good on the minutes.
Okay.
You have a second?
I'll second.
Can you just repeat that motion so that it can be clearly documented in
Like
the
my
minutes?
mumble jumble. What is this? I think, to reach out to see if NAMI National has language,
Not me, California.
NAMI California, sorry, has language with things you said around the resolution.
Okay.
If they have that, and then also, that we would hope that they're reaching out and supporting and lobbying.
Okay.
For support of this as well. So.
Okay.
And then, I don't know if you could maybe report back next. Yeah. Maybe that would be great, so maybe, put it on the agenda.
Okay, any other questions about the RFP? Okay. And then item G.
For G, can you, like, there's a lot of language, but I'm wondering if those are new programs or they've changed or they're existing and being. Do you know what I mean?
So they're not, they're not, technically quote unquote new programs, right? So we've been providing wraparound services
Right.
in Yolo County.
So how do these differ, I guess?
So I'm getting that. Give me a sec. So we've been providing wraparound. We have been providing first episode psychosis programming, and we have not formally. I think we've been in various iterations over the years of providing parent-child interactive therapy. What's different is that these are now going to be Medi-Cal benefits, right? So, for example, when we provide wraparound services, we provide wraparound services for foster children, essentially. So it's kind of a complex funding mechanism where we're using dollars that would otherwise go to a placement in a like a group home or something like that, and then we're able to use those dollars to fund wraparound services. And of course, we provide full service partnership services for youth, which are essentially wraparound services. But what is changing is that that wraparound services are going to be a defined Medi-Cal benefit for youth who meet the criteria, right? And then it's like fidelity to this model, right? And so there was a lot of work with the state around kind of picking like a specific fidelity model, and they landed on one that was put together by UC Davis. So UC Davis will be running the Center of Excellence to train the counties on how to adhere to the model, right? So what's required with high fidelity wraparound is that all the counties are required to have the benefit available to Medi-Cal beneficiaries that meet criteria by July 1. But there's a timeline to phase in actual fidelity to the model. Same with parent-child interactive therapy. And then the first episode psychosis, right? So, and these are just the evidence-based practices that we're required to be implementing on the children's side. There's also some on the adult side as well. And so what the update here is that we're working on developing the programming to ensure that we're going to be able to comply with this. And one of the RFPs that we want to do is for first episode psychosis. I don't know, is that?
Yeah.
Okay, all right.
What's the age range?
Oh, man.
So professional age youth was up to
Yeah,
25, you know.
in the children's system of care under EPSDT, it's 0 to 20, right? I'm gonna need to phone a friend or something around each of the, like, so for example, PCIT is like the model is really my memory is like 3 to 12, I believe, is like the specific age range that's targeted for. Like you wouldn't use PCIT with a teenage youth, right? So I believe that we would likely be providing wraparound services to youth under the age of 21. And then same with first episode psychosis under this benefit, but I have to get back with you. So I'm 99% sure that that's correct. With the PCIT, I'm definitely not sure, but the model itself isn't really intended for the children.
And you're likely doing your RFP contract out.
For substance psychosis, yeah. Yeah. We've been working with UC Davis for many years, and that they don't want to continue with us, right? And the contracting process is really difficult for UC Davis. For whatever reason, you know. So just D and G. I just gotta be honest with you, I'm like, I'm very surprised. I mean, I'm not asking to talk more, but.
I just wanted to say thank you, NH, for the update on the SB 43 on the LPS conservative. So thank you for providing that data. Great
Yeah.
to hear that one.
The one person was, I think, right now, US conservatorship. Yeah. It sounds like we had a few, at the time I was writing this the other day, we didn't have exact data. That's why I said at least 5. And a number was put out there and I was like questioning it, and I'm still trying to get confirmation on the number that I believe that it may be as high as 15 individuals since January 1 have been placed on 51 for people because of the statutory definition change. But we're trying to confirm that right now.
And I also wanted to follow up, last meeting, there was a discussion around giving this out to families, right, about, basically mental health support. Which is not SB 43, but around, yeah, careful. So I was just curious if that got back to you.
Yeah, well, I met Jonathan, sometime we talked about it, I got an appointment with Julie Frey.
Okay, great.
Yeah, and she and I are having coffee tomorrow morning.
Perfect.
So I actually want to write an article about it, starting out with a mom's story, the beginning of a family story, and then lead into, you know, the care court, what's going on, and some other options, and I'll bring it for some, you know, make sure I get some stuff right, but something with it.
No, it's great because again, you are providing classes for families.
Yeah.
But okay, I was going to make sure that loop was closed.
Yeah, and since I'm new here, I'm still figuring out like who are the past nominee families and can I access them through email blast? We're going to be having monthly community meetings again. We just had one that was pretty modest the other day, but we might do maybe every month where we have different speakers.
Okay, but I'm just gonna, I just want to make sure you know, we did submit the behavioral health services integrated plan. Okay, all right.
I have
Huh? Well, we submitted it to the state on Monday, right? It was due on Tuesday. Yesterday was a holiday, so we did send just before 5 o'clock. Do the portal, and then we will be released to public utility. So it's on the website. Everybody should receive an email about it. We're going to open for 30-day public comment period, and then I'll have a public hearing. We're also going to do 2 community engagement sessions, just to allow. I mean, it's not something we're required to do. We just think it's appropriate just to allow the community to. I don't know, ask questions, provide feedback. I mean, the way we would prefer to receive the feedback is through kind of a survey tool online, right, to help us to collect the feedback. But we did want to make sure that we provided an opportunity to provide, you know, review or maybe ask to answer any questions that the community might have about some of the plan. In part because the format is definitely different than what you've seen in the past, right? And so there's some areas of the plan that are they're a little hard to follow, right? And like we already received some questions. The initial review was around like, well, why is this and why is, you know, and it has a lot to do with the way that we we're required to submit the information. So it's like if we like a web portal, right? So it's like they're asking a question, there is a field to provide a response in, and then we have to respond back, right? And so we want to provide an opportunity for members of the public who might have some questions about, like, there's something here that just isn't really making sense to us, and give them, let us talk to it, as a part of, informing the community so that the feedback is more meaningful.
And then,
That would be much.
I've noticed in the report, seems like for some months, the clinical supervisory position is unfilled. Is there,
Oh, yeah.
you added the 8 additional positions that are going to require some supervision.
Yes.
Just, is there, I guess the other question, is there any consideration to going back and creating a TAY team?
Say more?
Any consideration of creating a TAY team again, now that it's all internal to the county?
So,
Just for people's application, transitional age youth was in 18 to 25. So for
16.
16 to 25. So there used to be FSP services focus Latino on that age group, and they would transition to the regular FSP. When it was contracted out to providers, the TAY team went away and was supposed to have a certain number of TAY slots for coverage. And so now that the provider is not doing it anymore, back to the county.
yeah, so I appreciate the question. Historically, there's FSP programming for all age groups, right? So you have a children's FSP team that was provided to you with a contract. To your point, there was an internal team that was focused specifically on youth ages 16 to 25, and then adult and older adult team. I do not currently believe that we have capacity or bandwidth to have like a specific TAY unit. However, I am personally and professionally motivated to find a way to make that happen at some point in the future. In the past, when I was a clinician, I provided services to the children's and TAY teams in a different county. And when I first came here, I was the manager of overseeing that TAY team. And so I completely see the value, especially in that being not necessarily a prevention, and not really an early intervention, but a form of an early intervention for youth that have already presented with some significant mental illness and trying to get in that going into assistance. We have had a lot of challenges with hiring supervisors. We had an active recruitment that was open for months, and we did not yield any candidates. We don't have a lot of internal staff that are really ready to make that jump from clinician to supervisor. A lot of that has to do with many of our clinicians being new to the field and still working on licensure. The hiring freeze has been really challenging for us as well. We're not currently recruiting for the supervisor position because all of the positions are kind of on hold at the moment while the county is still navigating through the county budget process. As you might have seen in Idaho, we're still trying to figure out the HHS budget, and because we're an integrated agency, there's a possibility that the behavioral health may still be impacted us in those budget decisions. So to your point, I currently have 5 clinical managers and 4 of them don't have supervisors. And so we have managers who are performing this supervision role, and they're doing an excellent job of kind of holding things together. But I agree with you. At some point in the future, we're going to need that level of supervision just so that we can kind of get everybody into their role, right? So like my managers are supervising staff, and they're like out sometimes fielding calls or doing whatever, and then also having responsibilities for doing the management aspects and providing sort of that systemic overview. And it's creating a lot of challenges not having that level of staff. So I don't know if that answered your question.
No,
it's just kind of, that's where we're at. I mean, that
8 new positions at 3 locations with all those services
Yeah.
without someone directly,
yeah,
is going to be a challenge. On top of everything else, that person's already.
it's like you're reading my mind, because we were literally just talking about this the other day, right? About, having offsite staff without a supervisor present on site, and then kind of how do we manage that, right? Luckily, the one site's right across the street, so that's not an issue. The other site isn't too far up away, I mean, it's just East Beamer is just kind of down the road a little bit. West Sacramento is a little trickier, but the good thing that we do have going for us right now is that we do have other staff and other kind of supervision is out there, like, so for example, in West Sacramento, we have our clinical manager tends to be out there a lot, right, for the crisis team. And so, I mean, we'll pull it all together, but like long term, yeah, we are definitely going to need those staff. I mean, you guys have heard me say this a million times, but like, there really is no way to properly give enough credit to the staff for then what they've done in this past year and the managers and kind of how their ability to hold the life project, right? And so I believe that we can keep holding it together, right? You know, and I don't want to oversell that point, but like I have a lot of confidence in their abilities when it comes to making sure the clients get services. Right? I appreciate you pointing that out.
That's all right.
Thank you.
We have a question around the process here. So we have to get the feedback, the public comment period.
Mhm.
That feedback is supposed to come back to this board.
If memory serves me correctly, which probably on the correct way to be giving out my hand like this, right? So there's a couple of different things that may happen. One is that we're going to receive feedback from DHCS, right? So the Department of Healthcare Services is reviewing a plan as well. They have 30 days to review it, and then we have 14 days to respond to their feedback. The community's also providing us feedback. And my recollection from when we did this last year is that we synthesize all that feedback, come here, kind of say, okay, this was the feedback we received, this is how we intend to respond to it. And then the board gives us some additional feedback and guidance around that. It's a public hearing, where we discuss what we've heard and what we intend to do about it, and then the board also has some input. And then we synthesize all of that into the final product that we get to the board. We're also anticipating, we'll get, we know we'll get feedback from DHCS, we know we'll get feedback from the community. Pretty confident you're all going to give us some feedback, right? And then we anticipate that we'll receive feedback from the board, and then we'll have to synthesize that all into a cohesive plan that we present to the board for final approval before being released.
No, because that's what we're doing then with planning now. So since we have some time.
Section B, it says we do next month.
I mean, there was discussion.
It looks, assuming it's gonna be on the May 6th agenda. We discussed it last month.
I thought we did. So I apologize. I apologize if I got it wrong. I
I
thought we
was
did.
online. But
Yeah. Oh, okay.
I'll be
Okay.
scheduling it as a public hearing
Right.
with the regular meeting next week.
Right, so then I think it's very important because we have a lot of members out, we have a lot of new members, is that I will send an email out to everybody. And if we could, I'll send it to Christina, if you could send that report. And so all of the members will get this with the information that this will be presented as a public hearing next meeting, and if that is their opportunity to provide feedback as well. So, and this, just so, I'm just concerned because we have so many numbers. Sure. I just want to make sure we're clear on this. And expectations, so, okay. We'll do that, so that's gonna be that's a big chunk of our agenda. For next month, which it should be. Okay.
That's up to you, but I would anticipate that it would be.
Yeah.
If I remember correctly, last year we had more public participation in that meeting than the other meetings, right? And I would anticipate the same.
So for agenda planning then, so we can go to share report outs and then if, the ready first isn't here, we'll do the agenda planning while we're waiting that this one. So ad hoc committee reports.
Yeah, we have rescheduled, so far the site visit to the 17th of this month. We got down to where we just had a couple of members that were going to be able to attend. And then there's a big questionnaire that they need to fill out. And I can send it to them, but I did not follow up and say, hey, can you do that full questionnaire? So anyway, it's just working out better for everyone to get off until April because it's a new process and it's not so simple, So anyway, we're gonna go out the 17th at 10 o'clock. Do you want it in the
Having precepts of bias and states feel is practical for new, and I believe the work done over the course of probably doing listening to this process. But if we have any complaints.
Nope.
For the rescheduling.
Thank you.
And thank you for all your work explaining this. And we look forward to it.
Hopefully it's spoken.
I'm sure we'll have it. And also it's for grateful for the process that the planning and have with the so we've been spoken for having quite you.
No, I think you're here. Hang on.
Team.
I like sporting on the pro.
All right, these are today, so we're going to see what you guys can say, next meeting. And then Kimberly, do you have anything to add on the annual report?
Just that we're going to present at the Board of Supervisors on June 2nd.
So, Christina, we can close that ad hoc, correct? For the annual report.
Once you present and we post to the website, then you can post them.
Yeah. I just also wanted to again, I don't know if I'm speaking out of turn, but I will again compliment you all on letting the federal judges on the hands of the it was very impressive. And so I just want to put it out there. I really appreciate it.
You did a great job. And it's nice, and not only the report, but Kim have created the process for moving forward, which I think was really helpful. And she did a lot of surveying of a lot of other mental health boards. So really appreciate her passion and work on it. So thank you for recognizing it.
I definitely think you got it right.
Did you say June 2nd?
Yeah. Is that it? Is that the date, Christina?
It is tentatively the date. Sometimes with the Board of Supervisors, the meetings get moved. So as of right now, it'll be June 2nd. I'll have to meet with you and Kimberly at some point because there are some documents that have to be filled out in order for us to submit and get it onto the agenda, but we can do that offline. I'll send them out to you guys.
That'll be the same date that we do in the DHSA.
You mean what did I have in the timeline?
June 2nd?
That's our target.
Okay.
Yeah. Wish me the best of luck. Right. We really need to get it done before June 30th this year. So, I mean, definitely we're shooting for June 2nd.
So we open up to the last public comment for the evening. Last opportunity.
He's supposed to be here at 7:30 and he hasn't joined, so.
Okay, well, let's, how about if we just, if the agenda planning, finish that up for next meeting, The reason it's new is that, where we have been, creating the agenda, how we've been meeting, we would really need to, it can't be an ad hoc meeting. And so for the Brown Act, it was just becoming very, a lot of Christina's time to have to come here. So you'd have to go in person and wait, and you'd have to post the agenda. So we're now filing, putting the agenda together during this meeting for the next meeting. And it's nice because it gets everybody's input. So we're going to try this for a little bit, see how it goes. If it doesn't work, we'll try something. Christina, what we have, so for presentation, basically then it's the plan, right? It's the public comment.
It'll just be under public hearing, so you'll call the public hearing to order and then close that as a separate agenda item. So you don't have to have a presentation for that meeting, since the majority of your time will be spent on covering the HSA. So you would just go through the rest of your meeting as scheduled with your mental health director's report and your ad hoc committees.
Is everybody okay with that, not adding anything else to the agenda?
Would we need a general overview in case it's someone's first time showing up for this, or?
The public?
Yeah.
I think.
Or not?
Yeah.
Okay,
Yeah.
just a Reader's Digest version overview for the public comment, in case.
You mean for the BHSA?
Yes.
Yeah, I'm happy to provide a kind of,
5 minutes.
yeah, like a sort of introductory, this is the, this is what it is, this is what we're doing, this is what the process is about, right? I'm happy to do that.
Okay. In case you have someone that's not fully versed on it, they've looked at it, they don't, who knows?
I will say that it's about a, what, 153 page document this time. However, there's pages that it doesn't have a lot of content, right? But it just kind of gives you an idea how many different data fields had to be entered, and they all had that content. So for whatever it's worth, like, happy to provide an overview, and if there are people that are not really clear on the process, we can have it.
Well,
It just might avoid questions for, just.
Well, I think that I'm really hoping that the community engagement sessions will also help with some of that. And, that we're kind of, we just wanted to make sure that we have an opportunity to start having that conversation before the public hearing. So we don't end up kind of maybe spending a lot of time on something that isn't as relevant,
All right, so before we adjourn, I want to wrap up since Supervisor Brooks. We need a motion. I mean, I'm happy to reach out to him and ask him the question around the approval from the Board of Supervisors. If that's the direction. To send a letter on behalf of this board to support funding global crisis services.
The governor's intent to remove the requirement for crisis intervention services, which also takes away the funding from the county. And we would want them to keep that in the budget. I think we'll all support that.
Yeah, assuming is that the process, I'm not sure if that is, if we do need the approval or not.
I don't think it's appropriate for us to engage an assembly person, which is bypassing the board without board, at least the board members assigned to this.
We don't need necessarily the whole Board of Supervisors approval, but the liaison to this.
Liaison,
Either,
yeah, I would think we would. Liaison could say that's a bad idea. Liaison for the Health Council thought it was a good idea, and encouraged it. So I brought that point up, where we're circumventing the board.
And Jonathan, is that?
Yeah, that's right. We want to fit into the board, it's pretty advisory.
Okay. So motion then, in the motion, I'll reach out to the supervisors, the 2 liaisons. And then if we get their approval, then we'll draft a letter and bring it back.
trying to get a copy of the one the health council doing on their issues, for formatting. Lawyers plagiarize everything too.
Yeah.
Can't help myself.
Did we need a motion for this? All right, I'll follow up then. Okay.
Can you also engage him on for the resolution?
Okay.
Oscars in the last time. As we get started on it, we already have a phone that have more overdose deaths.
So it's on down list.
They've gone down, yes. So I still have them. Yeah.
All right.
Thank you.
Thank you.
Yeah. For the jail visit. Do you want me to look at the contract?
Yeah.
I'll chat with you.
I wanted to, sorry, it's adjourned, right? I wanted to ask where exactly is the annual report on the county website?
It hasn't been posted yet until you present.
Okay, got it. Yeah, I was just like, am I having a bad time looking for it? But essentially it's already public, yes?
I can definitely post it. It'll be posted on the very front page, probably above either all of your names or below all of your names. And I'll send you the link as soon as I do it.
Okay, but essentially the content is public already because it's been part of a previous meeting, correct?
It's usually wouldn't post it until you close out your ad hoc, which won't be complete until you release it to the board. But I can post it right now if you want me to.
Things there, I mean, that's.
Okay, yeah. I just wanted to be aware of like where exactly it is and what's the
I'll
status.
post it and send you the link so you know exactly where to find it.
Yeah, no, I just don't want.
Yeah, and since it's public, it's okay to kind of
Over the years, I've heard a lot of.
just refer people to that link, correct?
Yeah.
Okay, cool.
Yeah.
Thank you.
Yeah, you bet. No problem.
For trying to start.
I'll get it posted tonight.
Well, part of it is, it's like.
So maybe a softball first.
Like.